Now, a global scramble is underway to contain a new Ebola outbreak in the Democratic Republic of Congo and Uganda. The World Health Organization now declaring a global health emergency with more than 300 suspected cases and at least 88 suspected deaths. And at least 6 Americans may have already been exposed, according to the Washington Post and CBS, citing 2 individuals familiar with the Trump administration's Ebola response and also international aid organizations. The CDC says the affected Americans are being withdrawn from the area. MS Now's Britt Miller has more on this outbreak.
It's the race to contain yet another deadly disease as an Ebola outbreak spreads through the Democratic Republic of Congo and into Uganda. Now, multiple reports citing officials with knowledge say at least half a dozen Americans have been exposed. The CDC is reporting 10 confirmed cases, more than 330 suspected cases, and nearly 90 deaths in the DRC. 2 cases are confirmed in Uganda, including 1 death, according to health officials.
This is a 5-alarm fire. I mean, this is a big deal.
Dr. Anne Ramoyne is an epidemiologist who's been working on Ebola in the DRC for a decade.
We're starting to see cases in places where you have a lot of mobile populations. And so this is really a recipe for a very large and extended outbreak.
This is the 18th Ebola outbreak in the DRC since 1976. The virus is mainly found in bats and spreads through bodily fluids.
It starts like anything else with fatigue and fevers, can progress to intestinal disease.
Experts say this particular strain, called Bundy-Bujo, is more complicated to manage, with death rates ranging from 25 to 50%.
We don't have the diagnostics that we need for it that are widely available. There are no vaccines or therapeutics that are licensed for this particular strain of Ebola virus. Containment is absolutely possible, but you have to throw everything you can at it.
The CDC says the risk to Americans and travelers is low, and it's working with interagency partners to safely evacuate a small number of Americans affected by the outbreak. The agency has also activated its emergency response center, helping with contact tracing and sample collection. Still, health experts are worried. President Trump has slashed the CDC, left the World Health Organization, and dismantled USAID, which provided foreign aid assistance for decades.
We are just not going to be providing the financial support, the technical support, all of these things. The U.S. has been a big part of that response in the past.
So far, the WHO hasn't recommended any travel restrictions. Britt Miller, MS Now.